Spring, of course, means allergy season is here. Joining us to walk us through some allergy symptoms and what we need to know about common medications is our favorite doctor, Dr. Garrett Peel from the Previty Clinic for Surgical Care. Welcome. I am very happy to say, very lucky to say, I don't suffer from any allergies, but there are people in my family who are some sneezing, wheezing all the time, not just in springtime.
Well, spring has sprung,
Yep.
and with spring break also comes hay fever. Millions of Americans suffer from what we call hay fever. Why? Because everything is pollinating. So pollen is in the air, and actually pollen can go across miles. And so people are very sensitive to pollen because it gets basically breathed in and it irritates the nasal passages, sometimes the airways, and causes a systemic response because histamine is released, and histamine is the problem. If you can help diminish histamine or block histamine, you can prevent a lot of the symptoms such as coughing, sneezing, watery eyes, all of those hay fever symptoms that can actually lead to serious medical problems if not treated. But again, the way you can combat springtime allergies is a few things. Number one, recognize that they're allergies, first of all. Talk to your doctor about your symptoms, especially those people who present with atypical symptoms like swollen face, unable to sleep, dark circles under their eyes. All of those can contribute to those atypical symptoms. So you don't really need to have hay fever symptoms.
Right, it doesn't have to be sneezing and
you don't
coughing
have to have
wheezing.
red eyes, coughing, wheezing. Those are usually down the road when those initial symptoms aren't treated well. So how do we treat these symptoms? That's, I guess, the key. We brought a few things here. Number one, the first thing is a non-drowsy Claritin. This is something that we give to our patients frequently. Also Allegra, again, this is essentially loratadine. It's about 10 milligrams. You can take it once a day. It's a 24-hour release medication. And again, it blocks the histamine production in the body, so it will block that systemic response to stay on top of the allergy. Another option is this fast-acting nasal spray. And this is a quick
kind of a quick fix over the counter.
It's a quick fix, but I have to warn people, you can actually get what we call rebound nasal congestion. This is for the stuffy nose. And what this medication does is it vasodilates the airway through the nose so that essentially all of that fluid and congestion will go away. But a couple sprays only. A lot of people overuse this like every day.
And they become reliant on it.
And they become reliant on it. And nasal cord is actually something you can get over the counter. And also there are some steroid options that essentially help with the inflammation. But really this needs to be supervised by your doctor. So seek medical advice when you're having these symptoms. Don't let them go too far. Some other things that can really be of help. Close the windows in your house when you have a windy day like today. That pollen goes through the air and stirs up. Vacuum your house with a mask on at least twice a week because that helps get those deposits out of your carpet. Absolutely. And drive with your windows up. Turn the air conditioner on to intra-circulation,
where it goes
not
through,
extra circulation, so that you're not sucking up all of that pollen.
All the outside stuff.
That's right, that's right. But there are some easy fixes, over-the-counter options that if you come down with some of those initial symptoms, you can seek treatment quickly and also make an appointment with your doctor to discuss the options, because what's most important is that we don't basically evolve into an asthma scenario where you have to be hospitalized.
And as we've always said, if it gets severe enough, if it's bothersome enough, doctor is obviously your first order of business.
My advocacy is to do it earlier, right when you're having some of those hay fever symptoms. And also something quick to note, children can have allergies too. Anyone over 5, recent studies have shown that children younger and younger and younger are developing allergies because it doesn't matter where you live, we all develop epitopes to our environment. These are little signals on the cells that react with those insults such as pollen and dust and mold, and it's a serious problem.
Yeah, it really is, and this is a topic that is really hitting home this time of year. So
it is.
Great information, Dr. Peel. We appreciate everything. Thanks for stopping in on this Wednesday. Let's get a check of today's forecast now with meteorologist Jeff Gerber.